Hello everybody. Welcome to No1doctor channel. Today we will talk about one of the famous doctors. George Gray Turner, 1877 to 1951. Gray Turner's sign in acute pancreatitis. In 1919, Gray Turner published an account in the British Journal of Surgery of the discoloration of the abdominal wall which may be found in acute pancreatitis. This paper described two patients, both of whom died of fulminating pancreatitis. The first had an area of bluish discoloration about 15 centimeters in diameter around the umbilicus, and the other, illustrated by a splendid black and white photograph, had greenish discoloration in the loins. He attributed the first to retroperitoneal fluid tracking along the falciform ligament and the second to fluid extravasating retroperitoneally to the flanks. Although these signs are rare, the tracking of pancreatic fluid into the retroperitoneum is commonly visualized on computed tomography in this condition. George Gray Turner was born in 1877 in North Shields, the son of a bank clerk. He gained a scholarship to the medical school of the University of Durham, at Newcastle upon Tyne, and graduated in 1898. After house officer posts in Newcastle, he worked at King's College Hospital and in Vienna, and was appointed to the surgical staff at the Royal Victoria Infirmary, Newcastle, in 1906. During the First World War, he served as a colonel surgical specialist in the Middle East. In 1927 he was appointed professor of surgery at the University of Durham until 1935, when he was appointed foundation professor of surgery at the newly opened postgraduate medical school at Hammersmith Hospital, London. Gray Turner was a master surgeon. His particular forte was major operative procedures, including oesophageal surgery, ureteric transplantation for ectopia vesicae, block dissection of the neck and excision of rectal cancer. He was also a wonderful clinical teacher. One of the authors, he can vividly remember a clinical demonstration that Gray Turner gave to the students at the old Radcliffe Infirmary in Oxford in 1951. He was a short man, dressed in a black jacket and striped trousers, heavy black boots, and wearing a very old bowler hat on his large head. We hung on to every word. Among his remarks that I jotted down and carefully preserved were, to detect vessel pulsation you want any amount of time and patience, we mustn't neglect the neurotics. In examination warmth and light make all the difference, especially suspect diabetes when there is gangrene in a rather atypical place. For example, the dorsum of the foot or the breast thing. Seeing the vomit itself, oh! What an important this wonderful man, who lived for surgery, died in 1951. Thanks for watching, hope to see you again in more next videos. With my best wishes. Dr. 8 Fomid.